So, what can you summarize as being the most impact on these, not only the drivers that drive for the fleets, but also these fleets? What will happen to them in regards to these change from the 5 to the 7 panel?
It'll be significant. For one thing, there is a process. You have to notify, the fleets have to notify, as a citizen and as an employee, I have rights. And so you have to inform me what I'm being tested for before I'll agree to whether or not I'll be tested on for you to come to work for you. So right there in itself, you have to change the entire policy to make sure that you've informed me of what it is you're testing me for, so I can agree or disagree to go forward with you in employment. So it'll have a significant impact in the way that you inform a person that's going to be tested, what they're going to be tested for. And then you've got the impact of the communication and the training to understand what it is that I'm being reported back to. So in other words, the MRO, who's been seeing it for years, will report back that positive, only to be broke down now as to what's your positive actually for. Now, they've always broken it down, but you're just going to have these other two panels that are going to say you were tested positive for ecstasy or you tested positive for heroin. It's another part of that expansion of this drug testing panel. Even though it's not a new panel, it's an expansion of the current panel on cocaine. So prior to this new rule, let's say a full line of cocaine would have only been a third of it reported out. Now that seems silly, but under federal mandate, they couldn't report the full line of the cocaine. And that's also what's changing. So now the laboratory, they lowered the cutoff rate under federal mandate to be able to report all of what they find in that drug screen. So therefore, the positive rate is going to go up substantially.